Hello, hello.
Hello, wonderful to see you. Thank you, thank you.
Please.
You know all of the, you know Miss Jana.
Jana,
Yes, come along, dear.
please come,
Thank
Jana.
you. Thank you.
I find it most exciting that all these people are coming together with an intention of making a difference to so many lives. It's not just in Bali, but it's continuing around the world. So we become a village. The idea of us being a village, we're all traveling together and we need to help each other and to understand each other and be together. And it's great privilege to know these people that are actually physically every day doing that work. This is astonishing work, and they've come together in a beautiful pattern. Thank you.
Thank you very
Thank
much,
you,
Jana.
Jana, and thank you for your significant part in all of this. Thank you all. I can't wait to go and do the taping. This is going to be such fun. But Jana just said something that I love, and it's a quote that I've often used. What are we doing in life? We're walking each other home.
Yes.
What a
We're
gift.
walking each other home.
Amen. Let's go. Selamat datang. Welcome. I'm Greg Johnson, and I want to welcome each and every one of you to this very, very special broadcast. As you know, I have a corporation in New York, Greg Johnson Partnerships International, and this is about as international as you can get, because right now we are in Bali, halfway around the world from New York, and yet we are totally united in my favorite topic, as you well know, family caregiving. I've talked to you, those of you with the UN NGO Committee on Aging, the Global Coalition on Aging, and many other organizations in America and in other parts of the world. I've talked to you about Sahaja. And today I am with the five founders. In my life, they're the Fab Five from America. And I'm so glad to be here with you. I just want to give you a little reminder of how this all began. Donnie Corniati, who is a good friend of all of ours, introduced me and said there are a group of people in Bali who are looking at the big question. Now, we all know what that is. How do we deal with the longevity revolution in which we are all participating, fortunately? But it leads to family caregiving. And so I had the privilege of meeting these five people who have had an incredible dream, a dream for many years. And they told me their dream. And through a series of dialogues where I shared the work we've done in America on family caregiving, they responded and we discussed it. And then I left it to them to take that information and create it in a model, in a pilot that was appropriate to the culture and life here in Indonesia. Now, this is my 161st visit to Indonesia, so I have a great, great respect for Indonesia, and I have always said its greatest resource is its people. For those of you who don't know it, there's over 17,000 islands in this archipelago. Yes, Bali is but one of them. But the pilot we are doing is here in Bali. Because in truth, you know, whenever we're talking about pilots and we're talking about academic programs, we tend to talk about them in the sense that we have technology. Well, we have limited technology here. We happen to be having some wonderful technology here at our venue, and I'm going to talk of that in a moment. But technology is limited. However, where technology ends, the great gift that is Indonesia and many other countries, that is human capital, intergenerational human capital, takes over. And that's precisely what these folks have done here in Indonesia. And I do believe we're here in the middle of a pilot that is something that we can all learn from. Now, let me introduce you. We'll start with the chairman right here, sitting next to me, Dr. Suka. They all have very long names, but I'm going to keep them very simple. They've suggested that to me. Dr. Suka is with Udayana University, and this you will find very interesting. You will hear the number of wonderful academic and healthcare institutions that each of these persons is serving in. And they have come together and have brought this pilot, which can work with many others. So, Dr. Suka, tell us about Dr. Suka.
Yeah, okay, thank you, Greg. Yeah, I'm Dr. Suka. Complete name is a bit longer. Yeah. Gusti Putu Suka Aryana. Yeah, I'm from Udayana University. Actually, I'm a medical doctor, internal medicine specialist, and as a geriatric consultant. This is a consultant for the health of the older people. And I'm working in the Prof. Ngurah Hospital. This is a hospital in Bali, the biggest hospital in Bali, and usually work for the older people in the ward, in the emergency, in the high care also. And yeah, I'm concerned to what we call interesting to build the geriatric service in the community, because that usually hospital now in the big problem because the big burden for the older people. We cannot care for the older people just in the hospital, but also we should be strengthening the health service in the community and the primary care. This is our concern.
Well, nothing could be more wonderful. And I'm so lucky I have my own geriatrician in Bali, and I've already used your services. Now, our host today is the president of ITKIS, and I'm going to say it again, the Institute of Technology and Health here in Bali. And I'm reading it so that I get it correct. And he's sitting to my left, Dr. Putu. Dr. Putu, take it away.
Greg. Yep. Thank you very much. So as Greg mentioned, my name is Dr. Putu Dharma. I have a nursing background with me. And every day, actually, I work as the president of the Institute of Technology and Health, Bali. So, Greg, 5 of us have the vision of how we come up together to create a better social system and a better healthcare system for older persons, not only in Bali, not only in Indonesia. If we may, we want to spread it to the world. So here in Bali, so we come as a group, Sahaja Foundation, and once again, our future goals is how we will be able to create a better healthcare system, a better social system for our older people. When we talk about older people, we are not talking about our current older people, because older people is our future. So within couple decades, we also will be in that age group. So we want to establish a better system start from now. We have to somehow start everything. There has to be a beginning of something. So my personal mission is once again how to create a better system, of course with caring as the basis of every activities that we have. And then if we talk about the caring, the family caregiver, the caring that is provided by family caregivers and everything is once again the foundation of what we are doing now. Or in Sahaja, that we are dealing with this issue, and once again, hopefully that we are able to create a better system for all of us. Thank you, Greg.
How perfectly said. And we are our own customer. I'm a bit older than all of you, but we always talked about that in New York and many of the organizations where we were talking about the older persons. Well, now I've become the older person, and we all will. But it's making this contribution. And as you so wisely said, it's not just in the medical facilities. because where does it happen? Most of the care is in the homes. Now, you've already met two of our wonderful founders. You see what incredible backgrounds and education each of them has, and this continues with our other two ladies. Now, Dr. Dia, she and I first met when all of this conversation began. You were doing graduate work in New Zealand, isn't that correct? Yes, yes. Dr. Dia, your doctorate is in psychology. Good, so you can keep us all organized. Tell us a bit about your work and also the work that you've done in the villages.
So, like you have mentioned, I'm a psychologist, and I took my PhD in psychology, specifically in health psychology. And my PhD is about aging studies and especially around the family caregiving. So, what makes me interested in this issue? Because the demographic of aging itself in Indonesia, and also my family personal stories in caregiving. So my father and my mother were caregiver for my grandmother and great grandmother, and my husband and I also, we are caregivers for our parents, especially for my mother-in-law who is bedridden currently. So having said that, I would like to emphasize that family plays significant role in caregiving, especially in Indonesia. And then I think that we can't leave a family alone in this frame. Family also should support by the system, like Dr. Putu have said, and also the policy. So I have a dream that if we could combine these two perspectives, the macro one from the policy and also the micro from the family, and what the NGO and also the social civil society do this in this issue, we can provide a better care for the older people and also the family.
How wonderful. How wonderful. And there's going to be a lot of people nodding their heads when you talk policy, because we have a lot of people who like to talk policy. You see, we do it here in Indonesia too.
I think that's the dream of every movement.
Yes.
That it's not just about movement, but the government, the policymaker, they have they concern and they notice what we have done at the grassroots level.
Exactly, and it's grassroots level that so often trumps the government and often will spur them into some action. There is no question, but it's the grassroots things, and it's leaders like each of you, and when it's all of you combined, the strength you have to say, no, this is what needs to be done. We're here. We are the experts on this, not only professionally, but personally. Yeah. That's terrific. Yes.
Say one more thing.
Sure.
And then for as a part of the society, we can't ask government to do everything, but we also have to contribute something. Yeah, we don't have to waiting for the government to do everything, but if you feel that you can contribute, then do that.
We all honor that, my dear. Bless your heart. I know you're applauding too.
I'm starting to be a politician.
Well, I think Indonesia's in good hands if you're going to be one of them. And each of you. Now, lest we are not leaving you out, this lovely lady. Once again, doctor, notice what great accomplishments in the most humble of persons. This is Dr. Sunny. And Dr. Sani, yours is in biomedicine, is that right?
Yes, that's right.
Tell us about Dr. Sani.
Yes, thank you, Greg. Hello, everyone. My name is Sani. As Greg said, I'm a doctor, and then I am. My background is a nurse, and I work at Udayana University as a lecturer. My expertise is in agrontic nursing, and then how and why I love to uh, work and care in elderly because they full of energy, full of experience, and so wise.
Bless your heart. Yes. You haven't forgotten the humanity.
Yes.
They're not a patient, they're a human being, just like each and every one of them. Oh, I love it. Bless your hearts.
Yes.
You can see why I was the one who ended up being the most blessed of everyone in this entire project. Now, we're seated right now in the room here at Ithacus. Did I say that correctly? I keep working on that one. We're here at the Institute, and we're in the classroom that is focused on long-term care. And so I think it's about time that we ought to show them exactly what you do. So let's move to the other side.
Here in the nursing laboratory of Institute of Technology and Health Bali, Sahaja conducted training for family caregivers and for health professionals to increase their knowledge, their ability to look after the older person at home. So in this setting, we do have one patient bed and some equipment, mainly to increase once again their knowledge and their ability to perform personal hygiene for the older person, and also how to fulfill the IDL and IADL, as well as how to give them some training on how to help older person moving from the bed to the wheelchair, and how to using the walkers and the frame in a better condition. So based on our experience in conducting this training, all participants that came in this room, they really enjoy what we gave them, and they really appreciate on what Sahaja services gave to them, especially on Sahaja training. So thank you very much for your attention, and we are going back to Greg in a second. Thank you very much.
Thank you so much for taking us and showing us exactly the type of training that you're doing. Now, I want to clarify one thing for the camera and for our friends all over the world. I talk about the Fab Five. I'm not included, so it's 1, 2, 3, 4. The fifth person we're looking at, it's our dear, dear friend, the administrative director of Sahaja, Vera. And Vera, terima kasih. She said she'd rather be behind the camera, and I'm safer on this side of the camera. Now, one of the things that I have been so impressed about, because I keep seeing photos that you send to us, and in those photos, you are often signing memos of understanding. Now that, I think, is utterly brilliant, because this is a topic, family caregiving, that's related to everybody else and everybody else's work. I mean, everyone has a family personally and professionally. The school is a family. We've talked about it's not just families of origin, but it's families of choice. The village as itself is a family of, you chose to live there, but they're not all blood relatives. I mean, there's probably a lot more relationships than in most, but the idea is there are many forms of family. And by what you're doing in signing these memos, tell me a little bit about it. Would you like to talk about that? Yeah, please.
Yeah, Sahaja Foundation is starting now is 1 year, yeah, 1 year, and we starting with the 5 person and founder, but we need to to increasing, I mean, that the quality and also to developing of the service and the training, caring and the training. So we make collaboration with the first with the Institute of Itekas, yeah, and we signing the memorandum of understanding that we collaboration not just for the all lecture in the institute but also for the student, so we can make collaboration to services more wide to the older people in the community. And the second of the MOU is with the primary care. Yeah, primary care center in Denpasar. So we need to do the collaboration with the primary care because that our foundation will deal with the older people there is in the community there's need of caring because that many older people in the Denpasar city is what we call is not just enough covered by the primary care service. So we do collaboration so we can find more what we call the detail and the specific older people that need help, need help for the caring, not just a problem with the health problem, but also maybe the social problem and other. So we join the collaboration, not just the caring, but also training, training for the all stakeholder in the primary care, training for the all family caregiver in the community. So I think that is we starting now in the past 1 years, and of course we want to more increase with the other organization.
Yes.
To increasing the work of the Sahaja Foundation.
I love what he's just said to us because he reminds us that in caring, it's not just about the curing part. Curing is very important, and we're in a medical institution. But caring has the social, the psychological, the spiritual, all of those pieces that make us who we are. And I was particularly, and I want to thank you, I love this map back here. We were in his village about 4 Sundays ago in Tabanan, where we had like 100 people. Some of you saw the video of us where I was just going, I can't believe this. It was wonderful. But we thank you for welcoming us and letting us see, and all of the staff, the nurses who were there were so many people. And it was the height of intergenerational. There were those of us who are very much seniors, and it were these wonderful young college people who are just beginning their lives. And that's one of the gifts of Sahaja, is it shows possible employment and opportunity in career, not just being a doctor or a nurse, but so many other pieces. It's education for everybody on healthcare literacy. It's also about bringing everyone together and allowing each person to be their full, authentic self and contribute that as a gift. Now, you also did some memos, is that right?
Yes.
Yes.
Correct, yeah. So Sahaja and the Institute of Technology and Health Bali already signed the MOU for the collaboration in 2 main activities of the Sahaja. One is Sahaja training. And the other one is Sahaja caring. So for the training, we collaborate in giving the opportunities for family caregivers and health practitioners to join Sahaja training within the School of Nursing in Itekas, Bali. So we invite family caregivers, we invite professionals to come and join Sahaja training. By doing this, we will spread the message, as you mentioned earlier, that caring is the soul of the curing from my perspective. Without caring, the cure is the cure, but it will not touch the heart of the human soul. So that is my own perspective. And then back again to Sahaja is that during the training, we not only give the opportunity for the health professional and the caregiver itself, but we give the opportunity for our future generation, especially for the nursing generation, to the medical doctor future generation, to have a feeling, to have an experience on how to look after older person in the real scenario. So we ask volunteer from nursing students, from medical student to become part of our Sahaja training activities. Some of our nursings and some of the medical doctors as well, they want to have experience working abroad. So by doing this, maybe in the future, once they finish their work abroad, so they can come back to Indonesia and strengthen our services for them. In Sahaja, we give them our perspective on how to strengthen the caring for the older person within our philosophy of Sahaja philosophy. And then that is the focus of Sahaja training. For the caring, we also care for older people and the family caregiver in needs of our service. As Dr. Suko mentioned earlier, that we already signed an MOU with Health Agency in Denpasar, and we are going to pilot this project in one village. So we will provide the training, we also provide the caring for the older person, Greg and everybody. So once again, Sahaja has two main focus, training and caring. So in the future, we want to strengthen these two main activities of Sahaja, especially by how we bring the technology together with the caring. As we all aware that our young generation is very good in technology. We are catching up with them. So we will bring this together with Sahaja facilities, how to conduct intergenerational activities with technology in it. So we will glue together family caregivers, older people in need, the technology, the younger generation, us within the system. In a very long goals of our Sahaja program, Sahaja activities is we want to create a hub to give a better solution of those in need. Hub means maybe a special service like a daycare service, once again for those in need, not to give the second option for the family caregivers. But you know, Greg, some family caregivers, they are willing to look after the older person, but at the same time, they also have full-time job.
Yes.
In some option, this is a dilemma. They know how to look after the older person. They know how to care of the elders at home, but some people, they don't have this option. And in Bali and in some of developed countries, we are still missing the service like this. So we are hoping that within 5 or 10 years, we are able to give a more and a better services for those in need.
How unbelievably exciting. Sounds familiar, doesn't it? That's the part that is so wonderful. As I sit here just overwhelmed by this conversation, I could be in New York, I could be in London, I could be in San Francisco. The weather might be a little bit cooler, but other than that, the topics are exactly what we're talking about. How do people work and our caregivers? What do we do in that situation? But by training others to care and doing it through an Udayana University, through Ithacus, it adds such quality to the experience, and it adds a great deal of dignity to a field that for so long nobody talked about. No one talked about it. Caregivers were silent patients. They were the ones who were getting sick. Now we address it. we name it. And then it's education, it's resources, and support. And Sani, I'm sure you have a great deal, as you're dealing with your students and lecturing, you have the opportunity of helping these young people to understand that it's not just the blood pressure and the A1C and all that sort of thing. All of that's important, yes, but it's a bigger picture.
Yes.
Do you find them really appreciating that?
Yes, they appreciated it.
Very good. So you find the young people very receptive.
Yeah.
That is an important thing.
Yes.
Because otherwise, they don't see the whole person. I think that's don't you find that too? There you are. Yeah. There we are. We're just sharing the. Yeah, Dr. Dia.
Yeah. When I did my PhD in about aging studies, one of my research talk about local knowledge and family caregiving in Bali, and I found one theme that very significant. It's about caring is intergenerational, obligation. So in our society in Bali specifically, we want to ensure the family caregiving within the private domain that across generation should be sustainable. We have to make sure about that. And then we think that we can't ask family to provide care if they don't know how to do that, if they don't have any support. Because on the other hand, we see that everyone busy with their life and everyone busy with their career. And also we notice that some family have financial difficulties around provide care. So we think that we want to fill this gap. The Sahaja would like to fill this gap, would like to provide support in terms of education and in form of knowledge, in terms of knowledge and also skill, that we support the family with those kind of support. Education, knowledge, to increase their knowledge and to increase their skill in providing care.
And I think you are all on the road to enormous success. This has been so marvelous to have this chance to talk with you. And I look forward to continuing our conversation. And it wouldn't be appropriate if I didn't also mention we have a group of people here in Bali. We don't call ourselves a board. We like to be the cheerleaders. And we are about 5 or 6 of us who come from very different backgrounds, but all love and adore caregiving, and all of whom give great thanks to you, each and every one of you, the 4 of you and our wonderful, wonderful Vera, who together are doing something that is quite extraordinary, and also something that is extremely replicable. And that is always something important. We look forward to telling you more about it and updating you on it. We thank you, and please know that you can always contact me. It's Greg Johnson at gjp-international.com. Send me an email. Once again, Greg Johnson at gjp-international.com. I'd be only too happy to introduce you to these incredibly talented persons, all of whom I love and adore and who are like family to me here in Bali. We thank you so much. And as we always say, onward in love and caregiving. Namaste.